Hello, good morning. I am Dr. Bishwas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, I am Gal Gadot, 55 years.
Nice to meet you. How can I address you?
You can call me Gal.
Okay, Mrs. Gal, I have got a letter from your GP stating that you have hand pain for last 6 months. Is it right?
Yes, doctor. Right.
Okay. So I am going to take detailed history and I may take some note during our conversation, but all the information during our discussion will be remain confidential. So is that okay for you?
Yes, doctor. Completely okay.
So can you please tell me in more details what is happening with you?
Yes, doctor. Actually, I was quite well around 6 months back, I think. After that, I have been feeling some pain in my hands. Okay. At the beginning, I didn't bother about it too much, but I think that it's gradually increasing in my severity day by day. And usually, sometimes there is so much pain that I cannot even. I am actually a typewriter, so sometimes there is so much pain that I think I have to. I want to take my day off from the office to have a relaxed day because the pain is so much severe. And also now, I think at the beginning it was in the hand, and now I think that the pain has there is now sometimes I feel some pain in my knuckles as well. Okay. However, I at the beginning I don't think that it was so much at the knuckles, but now I think sometimes at the knuckles also there is some pain. So the pain is quite severe, doctor, and I'm a bit nervous about it since my job is also related with my hand.
I'm sorry to hear that. And you said hand. So can you please show me exactly where do you feel this pain?
Doctor, I feel this pain, I think, in my finger joints. Okay, my finger joints, I think these are more affected, and sometimes the joints of my hand and finger, this these points are also painful too.
All of your finger joints or just few finger joints? Can you exactly tell me that?
I think, doctor, it's involved in both hands, and I can't completely say that whether all joints are involved or not, but I think most of the joints are involved.
Okay. And do you think that your joints at the tip of the finger or at the base of the finger, where do you feel the most the pain?
I think at the base of the finger it's
Okay. And up your both hands, you said.
yeah, yeah, yeah,
Or now also on the knuckle. Is there any other
yeah.
joints involved, like joints of your elbow joints, your wrist joint, or
No,
joints of your finger,
no,
the joints of your feet?
I haven't noticed.
And it started 6 months ago. And do you think that the pain is increasing gradually?
I think that it's increasing in severity, doctor. Okay. Previously, it was not so severe, but nowadays I think that it's getting severe day by day.
How frequently do you feel this pain? Every day, or sometimes of the day, or sometimes of the month?
I think it's almost every day, doctor, that I feel the pain now.
And can you tell me the how do you feel the pain? What is the feeling of this pain?
I think it's quite I think it's quite sharp pain, doctor. How can I tell you? But it's quite severe actually. When it occurs, I feel quite severe, and actually also I feel that there is some at times there are some redness over the joints. Okay.
Okay. And does this pain go anywhere?
No.
And you said redness over the pain area. Have you noticed any swelling?
Oh yeah, that doctor. That's another issue. I think I also have noticed some swelling at times.
And did you feel the warmth of the joints?
No, but I personally didn't feel it.
And do you think that your joints are becoming deformed?
No, I haven't noticed, doctor, but I haven't noticed, doctor.
Can you use this
Deformity.
finger properly?
Till now, I can use, but there are some difficulties that I have been seeing, observing recently. Okay.
And can you remember that? Do you feel any morning freezing or morning
Yes,
jamming?
doctor. Yes, yes. I feel quite amount of morning jamming. I think whenever I get up from bed, I think I feel very much exhausted due to the pain of my hands, and at times I have to wait for around 1 hour to be normal.
Okay, I'm sorry to hear that. And can you tell me that when do you feel the pain most of the time? At the daytime or at the night time?
I think as the day progresses, okay, when I start working, gradually I feel a bit better. But when I think I start to take rest, I think this pain just comes. I think so.
Okay. And do you think that this pain is hampering your sleep?
I haven't noticed, doctor, but after sleep, when I wake up, the pain is the highest, I think.
And do you think that anything that brings your pain or that worsen your pain?
I think this rest, I think, and this rest actually worsens it, I think.
And what makes it better?
Yeah, when I told you, doctor, I think when I work for around 1 to 2 hours, gradually I feel a bit better.
Have you noticed any changes in the sensation?
No, doctor.
Any skin tightening?
No,
Any changes in the tip of the color, especially when you're exposed to cold?
no, no, no.
Okay. Any wasting or any uh, uh, other sense of the skin or your hands?
No, doctor.
I am going to ask few more questions. That do you have any headache?
No, doctor.
What is about your mood?
Well, doctor, actually, I'm a bit distressed at now because of this pain. That's I'm worried about my job life, and I am the main earning person till now. So I'm not sure what's going to happen to me.
Okay, we'll take care of it. And can you tell me that have you noticed any changes in your vision?
No changes in my vision, doctor, but sometimes I think my eyes get a bit red. My colleagues tell me that, and sometimes I feel a bit some pain in my eyes. There has been 2 or 3 episodes of this.
And do you think that this discomfort on light exposure or bright sunlight exposure?
I haven't noticed, doctor.
Any rash anywhere in your body?
No,
How about your appetite?
it's quite good.
Any changes in your weight?
I haven't noticed.
Do you have any hot or cold preferences?
No, doctor.
Have you noticed any raised temperature or any fever?
No,
Do you have any cough?
no, doctor. I haven't. I don't have.
Any racing or pacing of your heart?
No,
Any chest pain?
no, doctor.
Any lumps or bumps anywhere in your body?
No,
Uh, and any tummy pain?
no, doctor.
How about your bowel habit?
Quite good.
Yeah. Did you have any loosey stool?
No, doctor.
How about your water work?
I think it's quite good, doctor.
Have you noticed any frothiness or any redness in your water?
No, doctor. I have noticed that.
Any joint pain do you have? Any joint pain of your legs? Any weakness?
No, no, no.
Do you have any past medical condition that you would like to share?
No, doctor, I don't have any past medical condition, but recently I went to a GP before coming to you, and he too did some blood tests. And after doing the blood test, he told me that I might have some pallo, okay, some problem with pallo with my blood. So I'm a bit nervous about it. Nothing else.
Okay. And do you take any medication?
Doctor, at the beginning, the doctor, my GP actually gave me some paracetamol tablets and some ibuprofen, and I have been taking 3 paracetamols daily and also 2 ibuprofen daily. But I don't think that they are helping me a lot. Okay.
Do you take any overdose of this medication?
No.
Do you take any herbal products or any over-the-counter medication?
No, never.
Do
No,
you have any
never.
allergy to any medication?
No.
I am sorry to ask, but do you take any recreational drug?
No, doctor.
It's fine. Any of your family member have this type of condition?
No.
Any family, any disease that runs in your family?
No.
May I ask you a few more personal questions?
Of course.
Do you smoke?
Yes, doctor. Yes.
How many sticks per day for how long?
I think around 10 sticks per day for the last 10 years.
Actually, this is injurious to health. Smoking is injurious to health and also related to a condition. So I would suggest you stop smoking totally. And if you need help, I can refer you to the smoking cessation clinic. Is that okay for you?
Yes, doctor.
Do you drink alcohol?
No, doctor.
That is fine. And you said that you are a typewriter and you are having problem due to your condition. And for that, I can talk to the occupational health department and they can do something for you. They can relocate your job or they can uh, manage something for you. So is that okay for you?
Okay, doctor.
May I know that whom do you live with?
I live with my husband and 2 children.
And are they supporting enough?
They're supportive enough, doctor, but I think that yet I have to do my job. Okay.
And do you drive?
Yes, doctor. At times I have to drive home with my car.
And this condition may affect you driving also. And also you have some eye issue. So let us find out that what is happening with you. And may I know that do you have any other thing that you want to add at this point?
Well, doctor, actually, what is it, and how do I get better? I think it's distressing my life, my job life, my whole life.
Okay. And one thing that I want to ask that are you menstruating or have you stopped your menstruation?
Stopped
Okay. For how long?
for around 5 years.
Okay. And actually, as I have taken your history, I need to examine you. Then I could give you the best answer. But as I have taken your history and your GP has ran some blood test, and it seems like that you have a condition that we called rheumatoid arthritis. Do you have any idea?
No, doctor, I have no idea at all.
Okay, actually, in this situation, joints, especially small joints of our hands and feet, get affected, and our own defense
Okay.
system destroys this joint. They are usually progressive if treatment isn't begun as early as possible.
Okay.
So for this, we are going to run some blood tests, and after that, we may also we will do some imaging test of your hand, and in the meantime we will involve the joint doctor, so they will start some medication, and you may
Okay.
need steroid medication.
Okay. Okay.
So for
And but doctor, I have heard that steroid has many side effects, doctor.
Okay, we will discuss this in details with you again, and after getting the test results. And usually we will prepare the drugs that is beneficial for you.
Okay.
Do you have any other question for me?
No, doctor, I
Enough.
think that's all right. Okay. Okay.
Thank
Yes.
you.
Okay. Okay, doctor. Well, so what is your diagnosis here?
Uh, for this lady, I think she has a history of typical history of inflammatory arthritis of small joints of her hand, and also has positive rheumatoid factor. So my first differential is rheumatoid arthritis. However, I would also consider other rheumatological condition like systemic lupus erythematosus also.
Okay, well, do you think that psoriatic arthritis can be a possibility?
Yes, it can be a, possible, but as rheumatoid factor is positive, so I will consider the rheumatoid arthritis first.
Okay. Okay, that's all right. But did you ask about nail changes?
Uh,
I think you
I,
should have asked about the nail changes. Okay,
I,
because
yes, I forgot.
yeah, you should have asked about some nail changes, some back pain, and also I think you should have asked about some pain while walking in the heels. This would have just suppose that rheumatoid factor is positive was not given. So at that time, I think this question would have been very important to rule out psoriatic arthritis. Actually, I think so. Okay.
Okay.
Uh, and okay, and now you are telling that DD SLE rheumatoid arthritis is all right. Do you think of any other? Can you think of any other DD in this type of small joint involvement?
Yes, I will also consider that is called psoriatic arthritis, then reactive arthritis, enteropathic arthritis.
Yeah, these are all seronegative. Any other cause can be because okay, let me tell you that in case of this type of small joint involvement, I think you should at first consider these three without any hesitation: rheumatoid arthritis, SLE, and viral arthritis. I think. Okay,
Yes.
so may I ask you that did you ask that just before this 6 months did you had any raised temperature? You told that do you have any raised temperature now, but I think you should have asked that did you have any raised temperature? Although viral arthritis usually can resolve on its own, but did you could have asked I think that did you had any raised temperature, any runny nose or something like that, any chest infection at that time? I think you could have asked. Okay, and now what investigations can you do? I think would you do in this patient?
I will go for the routine blood test, like complete blood count to see anemia and white blood cell count level. Then I will go for the inflammatory markers, ESR and CRP. Then I will go for liver function test, renal function test, urine for routine examination, random blood sugar level. After that, I will go for the anti-nuclear antibody level, then rheumatoid factor, then anti uh, uh, what is I forgot the
Citrulline,
yes, anti-saturated
citrulline.
antibody. Yes. Then also imaging of his that is X-ray of her hand.
Okay, that's all right. You told that there was some SLE, is a DD. Okay, so how could have excluded that from rheumatoid arthritis clinically?
Yeah, actually, for SLE there are other signs like
No, just hand sign.
respiration.
Just hand sign. Tell about just hand sign.
Okay, SLE also affect the small joints of hand, but there are mainly arthralgia rather than arthritis.
So no signs of inflammation. I think. Okay,
Yes.
so that's simple. And there were two other points actually you could have asked, but you didn't ask any oral soreness and any loss of hair. You just asked about skin rash, joint pain. Okay, so for SLE, I think you should have asked oral soreness and any loss of hair. I think. Okay, and now, how do you think you should manage this patient?
Okay, management of this lady by educating and counseling about her condition, then involvement of the multidisciplinary team, that is involvement of the rheumatologist, then involvement of the physiotherapist, and also involvement of the occupational health therapist. And involvement of the rheumatologist, they will assess her condition, and for acute flare, they will go for they may go for steroid, then disease modifying anti-rheumatoid arthritis drugs. And for physiotherapy, that is maintaining her joints activity, and also um, prevention of her condition of deformity. And occupational health therapist, occupational health department, they will assess her job, and they will do something that is suitable for her condition, with her condition.
Okay, doctor. I think that's fine. That's all right. But I think okay, that's all right for you, I think. But now, just I actually discussed with you while crossing you. So I think the case is almost done. But I think you just missed some points that I told you. Otherwise, it was quite okay, I think. Well, another thing, I have a query for you. That supposedly I told you that there is some problem with his urination. Okay, which is water work. Okay, suppose I had told you that I had some frothiness. So, what would be the causes in this case?
Okay, for her frothiness, there could be possibilities like nephrotic syndrome, then amyloidosis.
Okay, so what would you consider in this patient?
Amyloidosis and also nephrotic syndrome both.
Okay, that's all right. And okay, and other things I think you have covered quite well. Do you yourself want to add anything?
No, I cannot remember anything.
Well, I think that's good. And another thing that you have asked very nicely, actually, I was impressed that you asked specifically about the involvement by asking the base of finger and tip of finger. That was actually very impressive, because this could easily differentiate, because I think rheumatoid arthritis usually never involves tip of finger, if I'm not wrong. Okay, usually it's the DIP joint usually is not involved in rheumatoid arthritis, if I'm not wrong. Okay, so that was a very good point. And other things, it was quite right. Okay, so thank you, doctor.
Thank you.